said it.
Your baby's getting text messages?
Yeah, I signed us up for Text for Baby. We get free text messages every week. Look.
A car seat for the hospital. That's a great reminder. How do we sign up?
Text BABY to 511411 and you'll get free health and safety tips every week.
Okay, we're signed up. Look!
That's one smart baby.
Just like her mom.
Maybe Mary can get the wrestlers off the screen for us when she gets a chance. I just want to add my thanks to all the partners who have worked so hard in the state to really make this come about. You who work with the patients are the trusted source that they come to, and that's really the critical link in making Text for Baby successful. So thank you sincerely to all of you who have worked so hard in Delaware. I want to give a special thanks to Annalisa Ekblad, who first brought Text for Baby to the Center for Disability Studies and who is my unwavering support and guidance, and also to Ilka Riddle, whose vision and leadership really spurred us on to try to reach #1 for the Text for Baby contest. So thank you to both of them. It is now my honor to introduce to you Senator Tom Carper. Senator Carper served 23 years in the military and retired as a naval flight officer with the rank of captain in 1991. He started out his public service as state treasurer at the age of 29. You're not too much older than that now, are you? 29, I thought you had a longer career than that. When the state of Delaware had the worst credit rating of any state in America. 6 years later, with that credit rating restored to a respectable AA, he ran for and was elected to Delaware's at-large seat in the U.S. House of Representatives. After serving 5 terms as a U.S. congressman, where he earned a reputation as a results-oriented centrist, Tom Carper was elected the 78th governor of Delaware in 1992 and served 2 terms in that role. On January 3, 2001, Governor Carper stepped down 2 weeks early to become Delaware's junior senator. And when Senator Biden stepped down to become vice president in January of 2009, Tom Carper became Delaware's senior senator. In the Senate, Tom Carper serves on the Senate Finance Committee, the Environment and Public Works Committee, and the Committee on Homeland Security and Governmental Affairs. He also serves as chair of the Subcommittee on Federal Financial Management, Government Information, Federal Services, and International Security. He is passionate about improving healthcare and has been a longtime proponent of preventative care to reduce healthcare costs. His support of Text for Baby program has helped Delaware in so many ways. He has helped us to become a national leader in educating our constituents on prenatal and early childhood care. Please join me in welcoming Senator Carper.
Two ships passing in the morning.
Morning.
Sharon, can you hear me back there? Yes, I can hear you. Would y'all just turn around? Sharon, would you just raise your hand? That's Sharon. Sharon Cade, Delaware State University graduate, a great football player there, now our deputy Newcastle County director. And hi, Sharon, would you come up here, please? And I'm going to ask you about, would you come up here, please?
Try to stay as far in the back as possible. Hoping that you may not see me.
I think the visual contrast was pretty good. Y'all just flank him on either side. Somebody hold Sharon up. All right, Isabel, tell them what you do, please.
Hi, I'm Isabel Jones. I work on health policy for the Senator in his D.C. office.
Oh.
I'm Olivia Hayden. I also work in D.C. and assist with health policy.
And they're here not just for Text for Baby, but they're here. Tell them why you're here for this. I think exciting stuff.
We are doing an event later today on accountable care organizations with CMS Deputy Administrator Jonathan Paul.
Why is that important? Oh, tell them why that's important.
Accountable care organizations are a new way to promote coordinated care and encourage people to stop duplicate medical procedures and get better results for less money, which is the Senator's model.
All right, nice round of applause. Let me just see if you're looking through his eye. Some of the people, hi Lily, how are you? Some of the people look really familiar. You look sort of a lady in a hat. What is your name?
Sheila Carper Atkins.
Sheila Carper Atkins? I mean, where do you live?
Lexington, Kentucky.
Wow, you came a long way. What brings you here?
You had a birthday. I was your present.
My sister Sheila. Sheila was born about 15 months before I was. My mom had been pregnant before that and had a very, very difficult pregnancy. Almost lost her. In fact, we would never have made it into the world. Another difficult pregnancy with Sheila, but they both made it. And then I was born about 15 months later. So we know from our own family how difficult pregnancies can be and the delivery can be. And there's still times when it's very, very tough road to travel. I've been governor here for about a year. Mike Castle done a handoff with me, and I succeeded him. He went off down to Congress, and I got to stay here. I remember getting up one day and reading the newspaper, and it said Delaware was the first state in cancer mortality. That's what it said. First state in cancer mortality. And I thought, whoa, what's going on here? And we convened a bunch of really smart people, and they figured out we were not number one in cancer incidence, but number one in cancer mortality. And we put some real smart people together around this situation. They said the reason why you're number one in cancer mortality and you're like number 20 in cancer incidence is because you're not doing a good job in early detection and treatment. That's what they said, early detection and treatment. And we weren't doing a very good job in prevention either. You walk into the Delaware State Fair, the first thing they do is you walk in, I don't care what age you are, they'd hand you a pack of cigarettes. Pack of cigarettes. Could be any age. You could walk up to a vending machine and get cigarettes, Rita. And it was just not very smart. The world has changed a whole lot. We're no longer number one in cancer mortality. We changed a whole lot of things in the state, as you know. And I don't know. We dropped to 2 to 3 to 4 to 5 and 10. I think we're out of the top 10, heading way in the right way. I don't even know we're in the top 20 now. But there's something it's not good to be first in. Cancer mortality is one of them. Another one is infant mortality. And along about the same time we got the news on high rates of cancer mortality, we got a similar kind of report on infant mortality and decided we're going to do something about it. And we've been working, we've been working for like 15 years to bring it down and to help save a lot of babies' lives, to change our position as a state where we lead the nation, we led the nation in infant mortality, do a whole lot better than that. Rita continues to work. A lot of people in this room continue that work, and we're grateful for it. Some of my staff has heard me say this before. We have a lot of hearings in Washington. Some of you have been down and testified before. You've been in on hearings. You watch them on C-SPAN. Best hearing that I've been in, I think maybe in my 11 years in the U.S. Senate, was about 3 or 4 months ago. I don't think Isabel or Elwood were with me that day, but we had a bunch of really smart people, and the issue there, therefore, was deficit reduction. And they were going to advise the Finance Committee on which I serve and what we can do to bring down the deficit. One of the 5 witnesses that day was a guy named Blinder, Alan Blinder, the economics professor over at Princeton, but he had been, before that, the vice chairman of the Federal Reserve when Alan Greenspan was the chairman of the Federal Reserve. And like in most of the hearings, you know, that the witnesses start off and they give their testimony, and then we have a chance to ask questions. And when it came Dr. Blinder's chance to testify, he said these words in summary. He said, you know, unless we get our arms around healthcare costs in this country, we're doomed. Healthcare costs are the 800-pound gorilla in the room on deficits. They're driving Medicaid, state, federal funding, driving Medicare, federal funding. They're making our businesses uncompetitive. He said, in Japan, they spend 8% of GDP on healthcare. In Japan, they get better results, higher, longer life expectancy, low rates of infant mortality. In Japan, they cover everybody. And we send every night about 40 million people to bed without healthcare coverage. His message was, they can't be that smart in Japan, we can't be that dumb. And so he finished his testimony and said healthcare costs 800-pound gorilla in a room. The other witnesses finished, they had a chance to ask questions. It was my turn. And I said, Dr. Blinder, you mentioned that the 800-pound gorilla in the room is healthcare costs. And I said, how about sharing with us some, and I agreed. I said, share with us some ideas what we could do to drive that down. And he said, I'm not a health economist, I don't pretend to be an expert on this stuff. Here's what I would do though. Find out what works. Do more of that. That's what he said. Find out what works. Do more of that. And I said, you mean find out what doesn't work and do less of that? He said, yep. But in those few words are a lot of great, and we should be doing that not just on healthcare issues, but on defense, on domestic spending, on everything we do. Find out what works, do more of that. Find out what works, doesn't work, do less of it. This works. And one of the reasons why I'm passionate about Text for Baby, it works. It helps lower infant mortality rate. It helps make sure that when babies come out of a hospital, they're more likely to be able to survive the first year, 2, 3, 5, and be ready for roll into kindergarten at the age of 5, ready to be successful. And the thing that's great about it is that we're using a medium, we're using texting, that it works too. I had a big birthday last week. Some of you came down to the Queen. We had a huge party Saturday night at the Queen. 3 great bands. I don't know if anybody's heard Love, See Mama Jump Again, closed out the night. Oh, they were great. It was a wonderful, wonderful time. My sister come for that. But on my birthday, we have our 2 boys. They're now 21 and 23. Our oldest boy, Chris, a classic older child, focused, driven, motivated, never forgets a birthday, Father's Day, Mother's Day, any of that stuff. And there's Ben. Love Ben. But a year or 2 ago, my birthday's rolling up. And Christopher, morning of the birthday, he sends me a text message. Yeah, Dad, I'm going to have a great day. Sends me an email message. I get a gift from him. And then we talked tonight on the phone, which is really, really good. And that morning from Ben, silence. That afternoon, silence. It's like 9 o'clock at night. Silence. And so I send Ben an email. Nothing back. Around 9:30, I call his cell phone and leave a voicemail message. 10 o'clock, nothing back. 10:30, take out my cell phone. Text Ben. Ben, I'm going to bed at 11 o'clock. If I don't hear from you by then, you are off of the will. 10:59, Dad, happy birthday. Hope I'm not waking you up. But this, if I want to get through to my boys, that's what I do. And if we want to be able to communicate better, particularly to younger women that are having babies and aren't sure just how to do it, this is the way to do it. This is great technology, this is a great medium, and everybody that's a part of this, making this possible. I'm just happy on behalf of our delegation, Chris Coons, John Carr, and myself, the governor, to say we're doing some smart stuff here. And while it may not be good to be first in infant mortality, no, in cancer mortality, no, it's great to be first in Race to the Top, and it's great to be first in this as well. Thank you. God bless. You're doing it.
Thank you so much. In conclusion, we just wanted to give so many thanks to Christiana Care Hospital for hosting us today and for all your work in Text for Baby. We're thrilled to have 2 Text for Baby participants here today, Deborah and her little baby I hear there, and Ilka. So they're here to speak with the press or anyone else who would like to get a first-hand take on the experience of Text for Baby. There are press packets on the way out. There are information packets. There are what we call tear pads that give information about Text for Baby that you can give to patients, and a few other little goodies there, so be sure to check those out on the table on your way out. And I'm still pushing the food, plenty of food, so please stay and eat and talk with other folks in the medical profession here. And just thank you so much for all your enthusiasm, and let's carry this forward to continue to make Delaware one of the top states for Text for Baby. Thank you.